Hi, I'm Heath McGowan. I'm one of the anatomy lecturing staff at Bundura, and I endorse this clipboard product.
This clip is on the knee, its joints and congruency. So the knee isn't just one joint, it's a knee joint complex. It's composed of a tibiofemoral joint, so this is between the femur and the tibia. It's also composed of a patellofemoral joint, so this is between the femur, that bone of the thigh, and the patella or the kneecap. So pause the video now and work out for that tibiofemoral joint between the thigh bone, the femur, and that shin bone, the tibia. Work out its histological classification, its functional shape, and what movements are possible. Do the same with the patellofemoral joint, that articulation between the patella or kneecap and the femur. What's its histological classification? What's its functional shape? What movements are possible? Pause the video now and fill in this table. So the tibiofemoral joint, you should have realized, was synovial. If movement is possible, if the joint is freely moving, it's a synovial joint. Functional shape, we know that the tibiofemoral joint is a hinge joint. It flexes, it extends. It's a modified hinge joint because there's some rotation. You can actually rotate your leg at the knee joint a little bit. The movement's possible. It's a hinge joint, so we'd expect flexion and extension. It's modified because there's a slight rotation. Our patellofemoral joint between the patella and the femur, histologically, does it move? Yes, it does. It's a synovial joint. Its functional shape is a plane or gliding joint. It's just two bones gliding or sliding over each other. So the movements possible are gliding movements. Bony surfaces at the patellofemoral joint. We have the patella surface or groove. Note the prominent anterior projection of the lateral patella surface. So it sticks forward or anterior quite significantly. Our patella fits into these grooves, so it has facets, corresponding equivalent facets. For our tibiofemoral joint, we find on the femur, we have femoral condyles. These articular surfaces covered in hyaline cartilage, and they're rounded. That's for movement. We need to remember that the medial one is always a lot bigger than the lateral one. Just bear this in mind. You might like to think of, say, the adductor magnus. Magnus meant like magnification, meant really big. I think of my dogs. I have a maple, who is medial, who is big, and Appa, who is not medial. He doesn't start with M, so he's quite small. Just think of whatever reminds you that the medial is bigger than the lateral. We'll keep coming back to this. Between the two condyles, we have a fossa, so an intercondylar fossa. On the tibia, we have tibial plateaus. Now, a plateau is a flat surface. So we're looking at these predominantly being flat surfaces. We also have a tibial eminence, a sticky outy bit. What is the function of a sticky outy bit or a protuberance? So it must be for attachment. You can see it's not particularly congruent. Those joints don't fit together. There's not a lot of contact. That means that the femur could slip forward off the tibia, could slip backwards off the tibia, could slip medial or lateral from that surface, and that would cause a lot of damage. Congruence is a concept relating to the amount of bony contact that exists between articulating surfaces. It helps with the distribution of forces and the stability of joints. So here's the femur as we currently see it. We have the rounded condyles and the flat tibial plateau. There's not a lot of contact, which means all the forces are going through one point. Not very stable. We could slide off any direction. If we were to jam in a couple of wedges on either side, we would eliminate or reduce the risk of slipping off the side, and the distribution of forces would be more evenly spread. And that's what we've got. We do have these wedges, and these are called menisci. Singular would be a meniscus. These are called semi-lunar cartilages because they look like little half moons, so they're crescent shaped. We have a medial, which is massive. So medial is bigger than our lateral meniscus. This is because our medial condyle is bigger than our lateral condyle. These menisci are made of fibrocartilage. They are thick at the periphery and quite thin at the center. So they are wedge shaped. Medial meniscus is C-shaped, while the lateral meniscus is almost circular. It's smaller. We have attachments for the medial meniscus. We have the coronary ligament. We have the anterior cruciate ligament and the medial collateral ligament attaching to this medial meniscus. Our lateral meniscus attaches to the coronary ligaments, the anterior cruciate ligament, and the posterior cruciate ligament. It attaches also to the intercondylar tubercles, as well as to our popliteus muscle posteriorly. So we can see from this that our lateral meniscus is not bound or attached to our collateral ligament, our lateral collateral ligament. A medial meniscus is bound to our medial collateral ligament. Functions of the menisci: they increase congruence, they reduce joint stress, and being fibrocartilage, they toughen, they absorb shock.